I am currently working.
I have been going into work every day. I am considered an essential employee, and I have not stopped going to work.
I actually just got out of work after a 16-hour shift. So I came in at 7 in the morning and I was supposed to leave at 3, but then I stayed another 8 hours covering for somebody else who couldn't show up. It's a little unnerving. It's a little scary.
I'm an immunologist. I work at Scripps Research Institute.
I am a social worker and a therapist, and I currently work at a residential program for teens with young children. I'm the infant mental health specialist there.
Hi, my name is Tiffany. I work as a bartender for a corporate restaurant.
I'm a certified laboratory animal technician.
And I work as a CNA, a certified nursing assistant, at a nursing home.
With the way that it's been working, I would have, a shift or 2 or 3, if I'm lucky, kind of back to back, and then just have the rest of the days in my week where I'm off.
I work in research, and they basically closed us down except for essential things and COVID-19 research, which we're doing a little bit of. So that's actually good because then we, people in my lab a couple of them can keep working and hopefully help someone.
For us to get any successful therapies or vaccines for COVID-19, animal research is a required part of that. We have to use animal models to get the therapies that we find. And the research that is being done at my institution and institutions around the world are super important. Just about everything remains the same at work, except for the fact that there are increased security measures. We are getting our temperatures read every morning. We have to wear a fancy security badge. But other than that, business as usual.
I start very early in the morning. We only get like 30 minutes to eat, in those 8 hours, first 8 hours. And then I have to stay double, and I don't get to go home until it's 11:30. I don't get to be home maybe around midnight.
I'll spend the days where I'm working just kind of cleaning or grocery shopping or, cooking or doing laundry. And
if I have to do something on my days off, that would be like maybe grocery shopping, which is a pain because we have to make lines and it just takes a whole day because sometimes we can't even find the stuff that we need at one place. So we end up having to go to different locations.
Challenges that I'm facing right now is that we lack a lot of the PPE that I would normally wear because of nationwide shortages.
I'm kind of shocked that they don't have enough masks for medical personnel. You would think that at least would be in place.
Also, my institution making the decision, the totally appropriate decision, to go ahead and send some of the PPE that I would normally be wearing to people on the front line with people-facing jobs. I really don't interact with people much. I interact with a lot of mice. But since I'm allergic to the mice, I am getting the sniffles a lot more, and that obviously sends me into a panic, being concerned that I'm gonna get a fever or maybe I'm sick, and it's just been continually making me more anxious every time I start getting sniffly.
That I don't understand. I'm not a doctor. I'm a PhD scientist, so I don't know how that really works, but I would have expected that to be sort of taken care of. I'm kind of shocked that it's not. That is disappointing and disturbing.
At our residential facility, there's always a baby or a toddler who's sick. There are always runny noses. There are always coughs. And I'm always getting coughed on. I'm always wiping snot, changing diapers, even as in my role as a therapist. So it's really unique in that way. And so that's certainly like outside of my control.
Some situations that stress me out are like getting into the elevator, surrounded by nurses in PPE, who are just going up to their floors to take care of patients while I'm stopping on my floor where I take care of animals. I get really stressed about getting sick.
We keep getting a lot of admissions. So they come from the hospital right into the nursing home, and then there was this rumor saying that they were admitting patients with COVID-19 and that the administration was hiding that from us. And so a lot of people, some people quit, and some people just kind of like started calling out sick because they just didn't want to be here. And you know, like I can't, I don't have the luxury of like calling out sick because, well, what am I gonna do? That's just us. It's just I live with my mom and my two brothers, and you know, I work. I'm the only one who works, and the only one that can work. So you know, it's just put a little bit more strain on you know, being the provider.
Outside of myself and my roommate, really the only physical connection that I get with another person is servicing people at the restaurant, and you know, they're all strangers.
No, I'm coming into contact with other people who are not necessarily making the best decisions based on social distancing protocols, that it's really me that could be the threat to others. And that's hard, and it's been hard to figure out how to manage that.
It is so terrifying to me that I could bring that home to my roommates, one of whom is rather immunocompromised. So it could be bad, and that's definitely scary. But at this point, I gotta work. I gotta do this. I gotta make money. But I also, these animals need me, and so that's definitely something that's stressing me out a lot.
And it's been really interesting to see the dynamic shift, because people are either terrible or really, really sweet. There hasn't really been an in-between, you know, in dealing with people. I have people who are overly nice and sympathetic to the people that are still required to work every day. And then I have the people who are just so on edge right now and are just yelling at me about things that are wildly outside of my pay grade. So it's been really tough having that be my only source of connection to another person, you know, that I've been experiencing.
It is hard to be experiencing the things that I am when it's so different from all of my friends around me. And this kind of goes into just not feeling like I have a whole lot of people to talk to about the stuff that I'm going through.
As so many of my friends and even coworkers are working from home, my experience feels really different, and it's been hard to link up with people who are having this shared experience.
You know, it's just been tough.
It's been really nice to see how everyone is kind of getting together to make sure everything works.
I'm very attached to the people that I work with, the elderly people. Even though I have to work a long shift, it's just keeping me going, just knowing that, okay, I'm doing everything that I can to keep them safe and to keep my family safe, you know.
It can be really hard. And so definitely my coworkers, the veterinarian staff, my manager, all of the people involved at my work are the people really helping me get through it, get through the stressful time with so many unknowns.
And, you know, to know that I'm helping and that I'm doing something, it helps.
It's also been an opportunity to practice gratitude a lot more consistently. So, talking to people who are bus drivers, talking to people who are healthcare workers, again, all from a distance, but getting to say, wow, you're doing really amazing work. Thank you so much.
I've had so many people reaching out to me, about, hey, how are you doing? And hey, how's everything going?
And I feel like it's one of those things that we should do all the time, but we don't connect with people as often. And so even in this world of social distancing, those of us who are going out in the world, I think have been doing a really nice job of just buoying each other, because we know that we're all sort of stressed about the same things.
I actually celebrated my birthday in quarantine the other day, so it actually ended up being one of the best days because I was able to visit my parents and play with my dogs, and we had a whole group Zoom meeting with my brothers and their wives and my little nieces and nephews. So we all did a birthday toast, and it was just a really great time to feel like even though I'm still so far away from everyone, we're able to use these platforms to still connect and still talk to each other and to feel like we're still all in this together. So it definitely helps to keep in contact with the people that I've been close to.
This has brought home for a lot of people just how our mental health impacts our physical health, so much so. Because that's definitely been a shared conversation I've been having, whether it's our shoulders, our just body aches. I've definitely been noticing more physical symptoms of stress than I have before. And, as a mental health practitioner, I certainly talk about supporting people to manage stress in healthy ways. And no surprise that it is easier said than done. It's hard to consistently practice. So, even in doing this, I feel like this is part of my self-care. So thank you, Brian, for giving us an opportunity to just talk about our experience, because I think that's part of healing and just getting an opportunity to express ourselves in this time where it feels like a lot of things are just getting really bottled up.
So, yeah, thank you so much for letting me be part of this project.
Thank you.
I had an uplifting story. I'm trying to think of one. That's one of the questions. Uplifting story. Oh. Now everything's hard right now. Everything's really hard.